afternoon, ma'am. We're going to report about neurological and psychological exams. We are the Chinchong Pingling group. My report is about the appearance and behavior. First is the level of consciousness. And then normal is responsive, so the person should respond if you ask him a question. So if it's abnormal, it's either the person is lethargic or not, or obtunded. So that means is hindi siya responsive or inaantok siya or medyo slurred or mabagal yung response niya. So yung consideration can be stupor or coma. And the next one is posture and motor behavior. So a normal person should have a good posture pagpasok sa clinic mo. Pag abnormal, can either be tense, restlessness, anxiety, or fidgeting, which can be an indication of depression or if may schizophrenia siya, kung ano siya, restless or ano, content siya, may katago siyang pain or something. Considerations are, does motor behavior change under certain topics? Pag na-mention mo yung people or a place, kasi it can trigger like attacks for that person. Next is the dress, grooming, and personal hygiene. Of course, a normal person will be well-groomed. Siyempre, hindi siya yung basta-basta na lang kung ano-ano suot, tsaka hindi siya mabaho, and stuff like that. So, abnormal is deterioration, like if you're depressed, like kahit ano lang masuot mo, even if you're in your pajamas, tapos parang pupunta sa clinic, diba there's something wrong with that. Or excessive fastidiousness, yung super ano naman, maayos yung pananamit, like wala nang mali, it can be an indication for obsessive-compulsive disorder. So, one-sided neglect could be an indication of a one-sided lesion sa brain kasi it can either be na paralyzed yung one side niya or something like that. Consideration is age, lifestyle, and socio-economic group. So, age, syempre, if mas older yung person, mas medyo neglective yung tsura niya, like lifestyle is if nakatira siya sa medyo low class na area, of course, we can expect like the hygiene is not that great. Unlike sa mga super high class na area, we can expect na super ganda ng hygiene niya or super malinis siya. Next is facial expression. Yung normal should be open and friendly. And yung abnormal, syempre, could be anxiety, depression, apathy, or elation. Considerations are facial expression when at rest or when interacting. Kasi paminsan, the person can have like a resting sad face or angry face. So, baka yun lang yung normal niya, pero akala mo galit na siya. So, you have to check yung facial expression niya when at rest and when you're not talking to him or her. Next is the manner, affect, and relationship to people and other things. So, normal people will interact well with others, will have a social life. Tapos, yung abnormal is may anger siya, hostility, or isolated siya from everyone, pati family niya, friends niya, wala siyang dalon. Considerations is yung openness niya and approachability and reaction to surroundings. Kasi baka mamaya, introvert lang pala talaga yung patient mo. Hindi mo lang masyado natatanong. Next, or has anxiety or deteriorated yung itsura niya, wala siyang ka-ayos-ayos sa sarili niya, could be tense or angry or depressed. Okay, that's my report. The thought and perception will be reported by Miguel Oroña.
Let's check the person's thought content. Normal is circumstantial speech. Circumstantial speech means that a person is easy to understand and he can easily understand you. You have good communication. Abnormal, there's derailment. The person is changing topics. There's flight of ideas. He cannot concentrate. There's neologisms, incoherence, blocking, confabulation, preservation. He's trying to protect his integrity, his ego, echolalia, clanging, compulsions, obsessions, phobias, anxieties, feelings of unreality, feelings of depersonalization, delusions, persecutory or grandiose. Persecutory means he is being delusional about his pride, and Grandiose, he's being delusional that he's greater than everyone. And he may be jealous, erotomanic, or somatic. Unspecified considerations. There are delusions of reference without a prominent persecutory or grandiose component, or the belief that eternal events, objects, or people have a particular or unusual significance. In perceptions, he may have illusions or hallucinations. You should also check for the person's insight and judgment.
It's about mood. So, a more sustained emotion that may color a person's view of the world. Signs are elevated mood, sleep disorder, loss of pleasure, low self-esteem. Normal is a steady mood. Abnormal is postpartum depression, bipolar, dysthemic, and anhedonia, which we will discuss later. So the considerations are thoughts and feelings, maybe sadness, contentment, joy or euphoria, anger, and anxiety. So the first one is the postpartum depression. It happens when you have at least a baby within last 12 months. So postpartum depression occurs in women soon after giving birth. So symptoms include sadness or hopelessness. Counseling, antidepressants are the treatment options. Sometimes the mother felt that she can't be a good mom, or she has no perception, or the world has a great wall within her. So the next one is bipolar. So bipolar disorder is extreme mood swings. From depression to mania, used to called manic depressive disorder. It is an extreme change of emotions. Bipolar disorder is a very serious and can cause risky behavior, even suicidal tendencies, and can be treated within therapy and medication. Next is dysthemic. Dysthemic is also known as double depression. Dysthemic, sometimes referred to as mild chronic depression, is less severe and has fewer symptoms than major depression. With dysthemia, the depression symptoms can linger with a long period of time. So often 2 years or longer. Those who suffer from dysthemia can also experience periods of major depression. Dysthemia is common with children and teenagers because of school activities, and other causes of depression may be family or other factors. So next is anhedonia. So anhedonia is experienced through loss of interest in activities. It is used to enjoy and have a decreased ability to feel pleasure. So based on this picture, as you can see, the person has no emotions at all. So the core symptom of major depressive disorder is this anhedonia. It is also a symptom of mental health disorders. So experience anhedonia don't have a mental disorder, but it is a symptom or first symptom as a sign of mental health problem. So that's all. So most vulnerable patients in terms of mood are young, female, single, divorced or separated, seriously ill, bereaved, or with psychiatric disorders. So the next reporter is about speech and language.
So the next is speech and language. So these are the characteristics of patients who that includes quantity, rate, volume, articulation of words, and fluency. For normal, the person speaks clearly and distinctly. There is constant pace of speech, no nasal qualities in the speech, completes the sentence with correct words. For the abnormal, syempre yung vice versa ng normal, may nasal quality to the speech, so speech of depression, accelerated, rapid, loud speech in mania, dysarthria, which means it is a condition in which the muscles you use for speech are weak. Then aphasia, it's a communication disorder that results from damage to the parts of the brain that contain language. Then we have hesitances and gaps in the flow and rhythm of words.
Doc, tas may tas kaka-continue, may parang intermittent. Then disturbed inflection such as small tone, yung walang tone yung magsalita, doctor, alam mo, okay lang ako. Mga ganon. Then circumlocutions and paraphasias.
This is a demonstration of a brief neurologic exam, one that might be used in a general screening exam or in the case of a patient who comes in with undifferentiated neurologic complaints. Now, I normally would begin with a testing of the mental status, but in this case, based on the history, it's very clear that the patient's mental status is entirely normal. So I'll now turn to the cranial nerve exam. The first parts of that exam include examination of the fundus and testing of visual acuity, but we'll assume that that's already been done at this point. So to begin, I'm going to test your peripheral vision. And to do this, I'm going to be moving my fingers out here in the periphery. When you see a finger move, I want you to point to it with your hand, but I want you to look directly at the center of my face while we do this, okay? So look right here, and as soon as you see a finger move, point to it. Okay. Good. Now, if you could look at the opposite wall in the room. Good. Now I'm going to test the movement of your eyes. So if you could look at where my fingers meet, keep your head still, and just follow my fingers.